want to welcome everybody tonight to our virtual Missouri Livestock Symposium program. As we have moved forward through December, we've had several of these Zoom sessions, several recorded, several live, and so I want to tell everybody that's listening this evening, you can find those if you go to our website at MissouriLivestock.com. So tonight, I want to welcome our guest speaker for this evening, Dr. Larry Holler. Dr. Holler is a professor and South Dakota State University Extension Veterinarian and Diagnostic Lab Pathologist and Animal Reproductive Disease Specialist in the Veterinary and Biomedical Sciences Department at South Dakota State University. Larry brings a wealth of experience and also a sheep producer himself. So really looking forward to Larry's talk this evening, and his title is Trends in Small Ruminant Disease and Management. So thank you, Dr. Holler, for joining us this evening.
Thank you for inviting me. Thank you for all who are going to listen in. Hopefully technology won't leave us stranded here. Let's see if I can get a talk up. What do you guys see?
I can see your PowerPoint presentation.
Wonderful. And just to make Zach, I change titles like all the time. It's a really bad habit of mine coming up with one title and then just getting bored and shortening it. Basically what the goal tonight is to cover quite a few different topics, some high points, things that are going on, things that I'm seeing, things that producers deal with fairly routinely. Let's see if I can figure out how to. All right, so basically kind of a little bit about my background. I think my mother thought I'd never get a real job. I graduated from Kansas State University with my bachelor's in microbiology and my veterinary degree. Actually practiced veterinary medicine down in Lebanon, Missouri for a couple of years. Went from left Lebanon to take care of my dad when he was struggling with cancer, and from there I went on and actually started working in the diagnostic lab at the University of Wyoming. Kept moving west, ended up Washington State University, where I finished my PhD working on a little genetic disease I'll talk about in just a moment. I've been at South Dakota State University for over 26 years now. I'm the reproductive disease specialist, diagnostic pathologist. I actually am also dual trained, so I run the bacteriology. Well, I got a lot of good people that work for me, and they pretend I run the laboratory. And I'm also kind of the sheep guy. I do quite a bit of consulting. So Zach mentioned we have sheep. Our enterprise is called WH Land and Livestock. It is actually part of a biotech company called Glycoscience Research. Glycoscience Research basically utilizes the sheep we raise. Our sheep are carriers for a genetic disease called GM1 gangliosidosis. And lambs that are born with this disease produce a chemical called GM1 ganglioside. GM1 ganglioside is actually very promising treatment for Huntington's disease and possibly Parkinson's disease. We may actually give a talk about that at some later date. This is kind of an aerial view of the farm. When it started becoming kind of a research project, everything kind of grew. All the barns got bigger, and 2 years ago we had over 500 ewes that research ewes were lambing out. This last year I had some kind of significant health struggles, and we've kind of been slowly cutting the numbers down, actually fairly significantly. This year we'll probably only lamb out a little bit over 200 ewes. These are kind of what the research lambs look like. Originally, they, like all good genetics diseases, that started off in Suffolks. The picture on the right is cells in the brain, and they look kind of, hopefully you can see, they look kind of foamy. Those foamy vacuoles are the GM1 ganglioside. So we're going to cover a few things that we deal with in our operation. One of the things that's kind of become paramount up here in this part of the world is antimicrobial antibiotic use. Our largest packer has pretty much told people to quit using antibiotics. You know, it's a challenge. We'll kind of discuss it a little bit. Talk about some lambing time issues, cluster management docking, vaccination strategies, lamb health issues. Basically, with a little bit of the intention is to kind of touch on how to manage. You know, the reality is that the day of, you know, excessive antibiotic use is coming to an end very quickly. You know, so we're going to kind of maybe try to cover this in an approach of how to maybe limit that a little bit. The reality, antibiotic use, antimicrobial resistance is a phenomenally hot topic right now. Whoops. Oh, let me hold on a second here. And the reality, as time goes along, I think we're going to be more and more restricted as producers for what antibiotics we can use. We're pretty well already having to work with prescriptions from veterinarians for most all the injectable drugs, you know, with the exception of maybe tetracycline. You can't buy long-acting penicillin anymore. You know, they just basically, I don't think it's illegal. The manufacturer just doesn't produce it anymore. And it's all driven by a fear of antimicrobial resistance. The vast majority of the research we do in my bacteriology laboratory is on antimicrobial resistance in livestock production. And it's, while we're concerned with livestock production, they're more interested in the trends of resistance in antibiotics that are relevant for human use. More oversight, more records, and less options. It's basically, it is our future. Veterinary feed directive, I think most of you are familiar with that. Fortunately, small ruminants are somewhat spared the pain of veterinary feed directives for use of feed grade antibiotics. We're basically grandfathered in under the Minor Species Act. That being said, you know, it's only a matter of time. Natural lamb antibiotic free lamb programs are mandated by our packers, by our folks that are buying all our lambs. What the packers want, actually, they want antibiotic free. And if you are using antibiotics, they want a veterinary patient-client relationship, which is basically required for the veterinary feed directive. All right. risk factors for diseases we deal with. Obviously, these are just kind of generic topics: animal density, sanitation, environmental stress, air quality, humidity. The two most important for lamb pneumonia. New additions. So it's basically, did we have did biosecurity get compromised because we brought in a whole bunch of bred ewes? And of course, nutrition. Well, this isn't a nutrition talk. It is critical for the animal's ability to maintain health and to avoid, a lot of the infectious disease conditions we deal with. Kind of breaking out some generic or general categories here. In newborn lambs, South Dakota right now is having a little blizzard. We're looking at winds over 50 miles an hour, and we won't get a lot of snow out of it, but they're saying the temperatures are going to be dropping down to near zero. I'm not even sure what that wind chill will be. And so the guys that are lambing right now, yesterday we were in the high 40s. Tomorrow, not so much. So hypothermia, these guys are going to go from having it really good to they're going to all of a sudden really have to start struggling. Lambs are born with fetal fat, brown fat. They can survive on that for quite a while, devise their immediate energy sources, depending on how rigorous the environment, the temperatures are. Lots of different ways to warm lambs up, hot boxes. We use quite a bit of intraperitoneal 20% glucose solutions. Occasionally we'd take and actually do immersion. So when you come out in the morning and the lamb barely has a heartbeat, I'll put them in a plastic trash bag, put that bag in body temperature water and immerse them. I put them in the bags, so I try to maintain as much of the feed fluid, so when and if I can recover the lamb, I have a chance to take it back to mom. Dystocia lambs, weak-born lambs, it's an interesting group. Some of these lambs, you'll treat them similar to a hypothermic lamb. Be aware some of these long dystocia lambs, these lambs that are born, say for example, you're dealing with ewe lambs and her cervix didn't dilate, and you fought to get that lamb out. That lamb very well may have some hypoxic brain damage, just oxygen deprivation. And interesting in lambs is it doesn't necessarily show up immediately. Sometimes these lambs are as good as they're going to get once you get them going, and then they slowly go downhill, over that next 8 to 12 hours. Tube feeding, it's important to make sure, the lamb has got a suck reflex, that it's got at least some basic reflexes. If you take a lamb that's just almost still comatose, get out your stomach tube, fill it full of milk, basically that milk is going to start sucking what little energy that lamb has right out. And so you gotta do some of these things, get the lamb back up to a normal temperature, before you all of a sudden start tube feeding. Tube feeding is expeditious. You can get that done quickly, and most of you could probably do it in your sleep. To be honest, I'm a little better fan of, if you've got the time and the lamb has a good suck reflex, and taking that little extra time and giving that colostrum by a bottle. Does two things. That suck reflex deposits that colostrum into the abomasum. When that groove from the rumen to the abomasum closes, if you're using a stomach tube, that's all going to sit there. It's just going to sit there in the rumen until it slowly moves out. Clip and dip navels, it's a little harder to get a hold of the really good, strong tincture of iodine. Something about its use in methamphetamine production, I have no idea. But the challenge is the new products, a lot of them don't dry that navel up as quickly. And so you've got to watch that. You've got to, what we've done with a lot of the iodine products is we'll go ahead and add an alcohol, usually, isopropyl alcohol to that iodine, and that alcohol by itself is actually a pretty good drying agent. You can use the iodine for its disinfectant properties, but the alcohol will actually be a good, it speeds up the drying of that navel. Colostrum, 1 to 2 ounces per pound of body weight. There's a variety of quality of colostrum. Obviously, if that lamb jumps up and starts nursing off of mom, and life is good. Colostrum that's been frozen, it's better than no colostrum, but it depends how long it's been in the freezer. Bovine colostrum is probably better than nothing. Goat colostrum is probably the best substitute for sheep colostrum if you can get a hold of it, but the goat folks don't normally share. Udder health, strip and disinfect teats. We routinely, when we pull lambs or use the lambs into a jug, when we're stripping out, opening up the teat, we will take a disinfectant wipe. It kind of got a little wild last spring when all of a sudden you couldn't buy disinfectant wipes because of COVID. But we routinely disinfect the teats. Probably has a little benefit on mammary health, but it also cleans off the outer surface of that teat. So when that lamb does nurse, that first suck off that teat isn't, E. coli from that udder being, from that ewe being laying down in a manure-filled pen. You start that lamb off, as good as you can. Check for mastitis, OPP. A lot of times OPP, it'll feel really, really hard, firm bag. Often they may have some colostrum, but it doesn't last. Observe lambs, for starvation, scour, pneumonia, all the things we all do as shepherds. The reality is the sooner you catch any of the scours or pneumonia diseases, the better they're going to respond. Same with starvation. Dock castrate, there's probably lots of different opinions on how to do it. I never used to be a fan of using elastrator bands until I realized that my wife would do that and I didn't have to do it anymore. So now I'm a real big fan of elastrator bands. Docking lambs, tail docking, the shorter you dock them, the more your chances of prolapses are. Probably, realistically, the distal end of the caudal fold. I know a lot of purebred folks or show folks don't do that. Use new bands. The elastrator bands wear out. Don't save them from year to year. Buy new bands. Keep them clean. Keep all that equipment clean. Vaccine products. Most of you probably have figured out there's not just a ton of vaccines available for sheep production. Clostridial products is probably the largest category that is universally used by sheep producers. Historically, a lot of sheep producers use CD and tetanus. Now, some producers, depending on their feeding strategies, may have migrated into some of the multivalent or 7-way products. Some producers use some clostridial vaccines that have type A. In our flock, we have, with some of our TMR feeding, we've had some issues with a Clostridium organism called Clostridium sordelii. And so we've kind of had to go to a 7-way product, or well, it's a 9-way product. It's a cattle product. So you got to work with, if you have problems with clostridial diseases, you're not controlling it with C and D, you need to work with your veterinarian. So it may be time to change up your clostridial vaccination program. Abortion vaccines, boy, I can almost take this out of the talk because there's not a lot available. One company makes a Campylobacter and chlamydia product. To be honest, the quality of those products is not very good. Most folks in the upper planes that have Campylobacter problems have gone to making their own autogenous bacterins. We send, I would say, probably 50% of the isolates I get every year are sent out for somebody to make a vaccine. Chlamydia, we don't see as much chlamydia as we did historically. I think, all those years of feeding tetracycline pre-lambing, may have gave us a benefit of reducing our burden of chlamydia in our sheep flocks. There's a vaccine out for caseous lymphadenitis, caseback. Don't know a lot of folks up here use it. Occasionally, some of the show folks will use it. It's not a very gentle vaccine. You'll get a pretty big knot just where you inject it, and it does not prevent disease. At the very least, or at the very most, it just reduces the severity of the caseous lymphadenitis abscesses. ORF, not routinely used up here. If you use an ORF or sore mouth vaccine, you will have ORF in your flock forever. So it's kind of one of those things you want to discuss with your veterinarian, whether or not you're going to want to use it. It's not really the funnest vaccine to administer either. Respiratory vaccines, I actually had a call today, guy wanting to use respiratory vaccines in his sheep like he does in cattle. The reality is there's essentially no data on any of those products used in sheep. What little data we've collected at South Dakota State really doesn't show any efficacy. When people ask me, it's technically not illegal, to use these vaccines, although none of them are approved for sheep. The reality is, one, they're kind of expensive, and two, they probably aren't going to help in respiratory disease in sheep. We'll talk about that in just a moment. The challenge with vaccination in sheep production is we just really don't have a lot of products available. With clostridial disease, when do you want to give it? I'm kind of one of those that believes in giving it prior to lambing, so the antibodies are present in the colostrum when that lamb first nurses. Timing, routes of administration, these are all routes of administration, proper injection technique, proper storage. These are all all things that to be honest, the packer is going to get interested in as they start looking at the quality of the carcasses they're buying. Vaccines are designed to reduce the incidence or severity. They don't eliminate any of these diseases. I tell producers, pretty much any good exposure will outdo any of the vaccines we currently use. Lamb pneumonias probably are the most frequent question I get. How to how to get rid of pneumonias in the lambing barn, how to get rid of barn cough, that barn cough, barn cough, barn cough. Anybody that's fed lambs knows barn cough. Up in the upper plains, our challenge is we're trying to lamb in fairly tight confinement in the middle of winter because we want to get all the sheep born before we have to go farm. Probably the same in Missouri. Up here, the difference is we have the buildings are tight. We when it's cold and it's blowing, you're really struggling to maintain proper ventilation, keep the humidity out. Oftentimes, you're just struggling with lambing barn flow issues. How to keep keep all those newborn lambs away from all the exposure and all the organisms that the adult sheep pose. Anterior ventral. So if you're on the right side of this slide, that's basically that's the mnemonic lung. We've done research at SDSU actually following back when Iowa lamb was still in business. We would follow groups of lambs to slaughter, and you would be amazed. Probably 40% plus lambs go to slaughter at full market weight and have pneumonia that looks a lot like this. This is obviously a very young lamb. So this lamb, I'm going to guess just based on the fact that I've cut it open, probably died. A lot of lambs with these pneumonias will respond to treatment, and amazingly, sheep can survive pneumonias that cattle wouldn't even think of surviving. So these guys will go, you can get them over the acute bout. They kind of wall off the damaged area. They start eating again. They don't produce, they don't grow as fast. Their rate of gain is slower, but all in all, they will eventually make it to market. So kind of your typical Northern Plains, dark. I mean, I think you can look at that picture and go, gee, the humidity's out of sight. They're packed in there. You can see all the little eyes back there in the background. This is just, and you got lambing jugs with newborn lambs right next to it. I mean, it's a recipe, and this is kind of the definition of state-of-the-art ventilation up here sometimes. And so it's, the conditions for pneumonias are really environmental in nature. You need to be able to provide, if you really want to be successful in managing these lamb pneumonias and even the barn coughs, you need to look at the ventilation, look at your density, look at the air quality, get down on your knees. Boy, if you start coughing, your air quality is not good. Lots of bugs. We do a lot of bug growing. My bacteriology lab, we grow all these bugs. We'll do an antibiotic sensitivity. The reality is that pretty much all these bugs are susceptible to all the antibiotics that you could even want to use. The challenge is getting the antibiotic in the right time, at the right dose, and for the right duration. A lot of times we don't treat soon enough. We don't treat at the right dose, and we don't. Duration often is probably one of the bigger challenges. We figure one shot ought to do it, and so that's you need to work with your veterinarians, read the labels. Vaccines, I've already kind of talked about it. It's not. I mean, I'm not going to tell somebody not to use it. I would. Cattle vaccines are kind of pricey, and to be honest, they're not going to do much for you. But I've noticed occasionally over the last 30 years that sometimes sheep people are a teeny bit stubborn. High percentage of lambs go to slaughter with significant lung lesions. It's just a testament to how tough sheep are. Your average cattle guy won't admit that, but lambs go to slaughter with lesions that would kill cattle. Scours, it's often difficult sometimes to tell whether you're maybe dealing with a milk scour versus some kind of an infectious cause. When you're dealing with really young lambs, probably under 7 days of age, you're probably only looking at one, maybe two possibilities. That would be E. coli or rotavirus. Rotavirus can be kind of pesky. It doesn't, obviously, it's a virus, so you're not going to treat it with an antibiotic. And in order to be successful to save those lambs, you really got to be diligent with your fluid therapy. Salmonella usually doesn't show up until that lamb's a little older. Lamb will pick up salmonella most likely from a shedding ewe that's in the same pen. Older lambs, Cryptosporidia, Hymeria, which is coccidia. Coccidia is probably one of our biggest challenges we deal with, because by the time we get lambs back out into mixing pens, sometimes the density gets a little high. Sometimes when we're failing to control coccidia with our, we use a lot of decox in our creep rations. Decox often added to our salt for the ewes. When we find ourselves struggling, sometimes we figure out that we've also got a Cryptosporidia problem going on simultaneously. Crypto rarely kills lambs, but it makes it a lot harder to treat the coccidia. Salmonella, a lot of times, is more of a problem in feedlot lambs. I've seen salmonella outbreaks in lamb feedlots. That when you commingle a whole pile of lambs from a whole pile of different sources, and you've got some of them shedding salmonella, put them on a semi for a 12-hour ride, and then dump them out into a pen where they can't find feed or water, and then you'll see what salmonella looks like. Parasites can be a problem. It's more of a euflock thing. We'll talk a little bit about that in a moment, I think. Scours, there's E. coli is probably one of the bigger challenges. E. coli is a normal flora shed in the feces, so the baby lambs are obviously exposed to the organism just as soon as they're born. E. coli enteritis versus an E. coli endotoxemia. E. coli enteritis is kind of an infectious disease where the bacteria is the villain. It's gonna get into the intestine. It's going to attach to the intestine. It's going to produce toxins. It's going to do bad things. E. coli endotoxemia is actually probably a lot harder to deal with, but to be honest, the bacteria is kind of an innocent bystander. When you have a baby lamb and its first nurse off of a dirty manure-covered teat is E. coli, those E. coli may not necessarily go in and cause a lot of disease, but they're going to start to grow. E. coli grows rapidly. And then all of a sudden, E. coli becomes a predominant organism in the abomasum in the stomach, because the lamb just sucked it in. Those E. coli keep growing and keep growing and keep passing through the intestine. While they, just by their nature, their entire outside is made up of a molecule called LPS. LPS is endotoxin. So as those bacteria grow and then they die, more grow and they die and they grow and they die. Well, as they're dying, they release endotoxin. So this endotoxemia is what we refer to in some of these baby lambs as watery mouth. Watery mouth is extremely challenging to manage, because our temptation is to grab an antibiotic and treat that lamb. grab an oral antibiotic and treat that lamb. Well, that antibiotic is going to kill more E. coli and release more endotoxin. So you basically are, for better or for worse, you're speeding up that lamb's demise. Basically, fluid electrolyte therapy, you need to figure out what kinds of electrolytes, fluids you can use, oral, subcutaneous, intraperitoneally, intestinal protectants. There's a lot of Pepto-Bismol goes into lambs in the lambing barn, plus or minus antibiotics. You need to know a little bit about why you're using that antibiotic, and is it going to help or is it not going to help? And that's where you need to probably get some consultation. Prevention, of all these scour issues, sanitation, colostrum, the teat cleaning, for us has made a huge difference, especially in the watery mouth category. Everybody's still there?
Oh yeah, we're adding more people all the time.
All right, just nobody's died, right?
Okay. Nope.
Okay. All right, so clostridial diseases. It's kind of actually one of my research interests. Clostridium perfringens causes this family of diseases we refer to as enterotoxemia. We have this alphabet nomenclature: A, Clostridium perfringens type A, all the way through E. I mentioned earlier another little bug called Clostridium sordellii. It's a really interesting little bug, and it is really, really, really a killer. And it has similar pathogenesis to the Clostridium perfringens. All these bugs produce toxins, lots of toxins, and gas. So the highlight you'll often see is, you cut them open, you'll see these red intestines that are filled with gas. These bacteria grow rapidly in the abomasum all the way down to the ileum. Sometimes these things produce gas so fast that the intestines fill up with gas and then they twist, and you'll get these torsions around the base of where all the blood supply comes into the intestine. I'll show you a picture here in a moment. A lot of times you'll see massive hemorrhage in the lumen. One of the toxins these guys all produce destroys red blood cells, causes blood vessels to leak. A bacterin versus a toxoid. I mean, this seems kind of silly, but it actually is critical to trying to understand why it is so difficult to control this group of diseases. A bacterin is basically a vaccine product made from dead bacteria, whole bacteria. We kill the bacteria. You might put something in there to make it a little stronger and produce more antibody, but it's just dead bacteria. A toxoid is the toxin that the bacteria produces inactivated and used as a vaccine product. The reality in all these clostridial diseases, the toxoid component is the most important. Most manufacturers produce a bacterin and kind of hope they've got a toxoid in it, that the bacteria was producing toxin when they killed it. The problem in the US is we don't know that. No manufacturer is required to tell the producer or the veterinarian how much is bacterin, how much is toxoid. That being said, in England, in the European Union, New Zealand, Australia, that's required. When they sell a vaccine, they have to tell you how much toxoid is in there. So basically, these are what you see. The really, really dark red portion there, that's a torsion. That intestine is blown up, and it's made basically cut the blood supply the returning blood supply off, so that intestine's just full of blood. Unfortunately, I have way too many pictures like this on my cell phone. It's kind of gross. I have pictures of my children, and then pictures of dead lambs, then pictures of my children, and pictures of dead lambs. Anyway, notice that Chicago cutlery knife, really nice necropsy knife. There's probably one in your kitchen. Gentlemen, I'd be a little cautious when you take that out of the kitchen to go cut up a dead lamb. Be sure you kind of wash it before you return it. Coccidia, the genera Eimeria. Often these Eimeria are species specific, so there'll be Eimeria specific to sheep and calves and chickens and turkeys. Pigs usually use Isospora, but anyway, they're all the same kinds of protozoal organism. Causes diarrhea in young lambs, kind of not real young. They got to be old enough that they've had a fecal oral exposure, plus the coccidia has to develop. So probably you won't see a lot of coccidia, probably much less than 10 days, 2 weeks of age. Gets more of a problem by a month. Usually for us, coccidia is kind of a big hassle by the time we're trying to start weaning. Can be a real problem in bottle lambs. These lambs, the challenge with bottle lambs is if you bring older lambs, if you pull older lambs back out of the pens, put them in with your younger bottle lambs, everybody in the pen's going to get coccidia. For bottle lambs, we have raised lambing or raised bottle lamb pens. Once that pen is populated, you don't add anything old back to it. We actually try, if you pull lambs out of a pen to put on a bottle, they don't go in with any of the young lambs. They're going to get, hopefully you got a spare lamb and jug somewhere where they'll get isolated by themselves. Sanitation, animal density, keep lambs all kind of grouped by age if possible. Coccidia stats and creep, we currently use Decox. Bovatec hasn't worked for us for probably 15 years. A lot of the producers I consult for in the Pipestone project, I'm pretty sure there's a lot of Rumensin being used. That being said, I think it kind of is coming to a really quick halt because Rumensin is an ionophore antibiotic, and Superior Packing has pretty well told us all over here that that's kind of one of the antibiotics they're going to be looking for. So Decox is still approved. It works. We found we've had to up our dose a little bit. So basically we'll get a ration with Decox, creep ration with Decox, and we may actually add some more Decox somewhere into the equation because it seems like we need a little higher dose. Sulfas, Corid works good for treating clinical. Corid is Amprolium. Several years when we have really wet, horrible conditions, which you can get all the time in South Dakota, we've had to treat everybody. As we wean off groups, we'd have to run them through a 5-day course of Corid. Crypto, for those of you probably never seen it, it's a little guy. This is basically a fluorescent stain that these are the little cryptoocysts that you kind of basically do a little different flotation, and then you can stain them. So they're little spherical things. A lot of times on histopathology, you can actually see these little organisms attached to the cells in the intestine. Fecal oral, usually self-limiting. it's dual infection with coccidia is kind of what makes it, so if I'm working with producers and they just cannot control coccidia for anything, then we go look and see if they've got a dual infection. The cattle guys use a drug, Ponzarel, 15%. It's not approved. It's actually a horse drug, but the cattle guys use it a lot for crypto control in calves. Seems like the wrong time of year to think about parasites, but to be honest, in my parasite way of thinking, it's kind of the beginning of the yearly cycle. Parasite control, parasite management has probably been the most challenging thing we've dealt with raising sheep in South Dakota. Because of a lot of the management practices that are involved in our genetic research, we created and partially because of stupidity, that's my fault, my bad. We created phenomenal genetic resistance to antiparasiticides. Veterinarians, I was led down the path of, just get more drugs to treat more problems. And we created an actually genetic resistance problem that for a while there we thought was going to limit our ability to raise sheep. Fortunately, my best friend is a parasitologist. And so we used our flock for probably the next decade in developing some strategies that would work to control parasites. Our primary parasite was Homunculus. And I'll kind of cover a few of the things that we learned. Antiparasiticides, strategic worming, to be honest, I had been doing everything wrong for a long time. My problem was I could get drugs for free. The drug reps would give me anything I wanted for free. I didn't have to pay for it. Therefore, I abused these drugs. Proper dosage wasn't really a big problem. Just strategic use was our big challenge. Parasite resistance is probably one of the bigger challenges facing sheep production in any of the, most of the United States, and a real challenge. I'm guessing you guys down there, a lot warmer climate, your parasites probably don't even die in the winter. Resistance can be purchased. I'm not sure that's kind of not the right place for that little phrase, but it's very interesting. I see it all the time in goat producers. Some of the parasite resistance in goats is phenomenal. And if you question these people at length, I'm pretty sure most of them bought their problems from other sheep or other goat producers. Control programs, pasture rotation, clean pastures. We've found ourselves, we never used to pay a lot of attention to rotation. We had lots of sheep in big pastures, and we put them out there until somebody got ambitious and moved them. But we now rotate every 5 days. Right now, I wish I had another, half a dozen pastures in the rotation, and basically that just requires me building more fence. But my fence building has been put on hold temporarily. The larva probably survived pretty well in your conditions down in Missouri. The good news for us is the infective larvae don't survive winter in South Dakota. They do real well during the normal season. If we have good, moist, rainy, wet the larvae do fine. Larvae don't like hot, they don't like dry. And so that, every year managing for managing our pastures is a real challenge. Pretty sure in Missouri, you guys don't get a lot of breaks. Your parasites are probably almost, if it's like I remember in Lebanon, Missouri, they're probably pretty dang happy all year round. They might get irritated for a week or two, but that's about it. So the important thing, this isn't intended to be a parasite talk, but this is one of the take-home messages I want most folks to understand with parasites, homuncus, pretty much any parasite. If you look at the left-hand side of this graph, the big tall bar, that's 0 to 10 eggs. So a vast number of sheep in the flock are producing hardly any eggs at all. And so then you look at the bars as you go across. 12 are producing 11, da 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 da. You get out there at the very end, and you've got those 3 ewes producing the 900 plus eggs per gram. You take that little yellow circle, those 9 sheep are producing 63% of the entire egg burden for the flock. So your challenge becomes, how on earth can I identify those 9 sheep? How do I identify my egg producers? And it's not easy. It helps having a parasitologist for a friend. We've done hundreds, if not thousands, of fecal egg counts on my sheep, trying to identify these animals. And when we identify these animals, we cull those animals. Hopefully they all go to slaughter. We don't ever sell them to the sale barn. So it's those few animals out there at the end of that graph that produce all the eggs. Let's see here. Important to remember, especially when you're developing ewe lambs for replacement. Lambs don't develop immunity until they're probably 6 or 9 months of age. So in my flock, when we're raising lambs for replacement, we pick those lambs out actually fairly early. They'll be in the, our lambs never see pasture, and then we pick out replacements probably 4 months of age. So these are naive ewe lambs, and actually a lot of times they can be pretty naive. They may never have seen an internal parasite that whole first year. Now we've kind of changed that up a little bit. We let those the ewe lambs we pick for replacements, get a little exposure to the ewe flock. We want them to see. We know we can't keep them sterile forever. They're gonna run with the ewe flock eventually. So that 6 to 9 months of age, when they're developing some of that old enough to develop immunity, we give them some exposure. Ewes, the challenge, the parasite season starts in that probably month before lambing. Ewes go through a period called periparturient rise. Basically, when you look at pregnancy is basically an immunosuppressive condition. The ewe's immune system is downregulated because she's carrying fetuses inside her that are half somebody else's DNA. Half the DNA comes from the ram. So she downregulates her immune system in order to maintain those pregnancies. Well, that downregulation makes her susceptible to all the abortion diseases. That's why we see most all those conditions occurring late gestation. but it also makes her less able to deal with internal parasites. And so during that period prior to lambing, and then for that short period after lambing, that's often when the ewe will see the biggest release of larvae that have basically overwintered in her body. Those larvae mature, they develop into adults. If it's a parasite like Homunculus, they'll start drinking blood out of the stomach like nobody's business. And if you're not watching, you'll have ewes that are going to be dying of Homunculus because they become so severely anemic. They're carrying, set of triplets, and all of a sudden you've got some down ewes. You think, well, guy must be ketosis. Check and make sure that they're also not simultaneously fighting, a parasite burden. Basically, there's 3 different families of antibiotics. The 2 most commonly used are the macrocyclic lactones and the benzimidazoles. The last one would be the levamisole group. The reality is you're going to need some help trying to design a treatment program with drugs. Drugs alone, you will develop parasite resistance. They used to recommend rotating wormers. The reality is that tends to just develop resistance to multiple classes of anthelmintics simultaneously. We have gotten, to the stage in our management that we don't treat anything that doesn't clinically need to be treated. We haven't whole flock medicated for a long time. It's probably one of my least favorite things in the world to do is to FAMACHA test a bunch of ewes, but that's what we do. And we only treat clinically anemic sheep. We stay primarily, we've developed resistance so bad we don't have a lot of tools in the toolbox. Cydectin drench is still probably one of our best drugs. Levamisole is a very old wormer, and it was hardly used for decades. The fact that it was never used means that all of a sudden it is something we can use. Problem with levamisole is it only kills adult worms. So it's not a bad wormer to use in the spring once all the larvae have hatched out and you've got a whole population of adults. Levamisole does a pretty good job. I don't know, probably can't see that life cycle picture, but the reality is the infective stage of the parasite, the eggs are excreted in the feces from the sheep. They develop into infective larvae, and they climb up on blades of grass, and they wait for the next sheep to come along and eat them. Now that period from eggs hitting the ground to developing to infective larvae is probably about a 5-day period. We tend to rotate every 7 days, which probably is not optimal, but you do the best you can. Let's see here. Pasture management, the challenge you're going to be, it's always a good winter pre-lambing treatment. We really don't do that anymore. We monitor, if anybody that's clinically anemic at around lambing, we will treat them, but we don't treat everybody. try to maintain uncontaminated pastures. Basically that's the theory behind pasture rotation. You go from clean pasture to clean pasture to clean pasture. You let them rest in between. Hopefully it's hot enough and dry enough that the larvae die. Sorry, I know that doesn't happen in Missouri, but that's what we hope for up here. You can till, you can plant, you can farm, all these strategies to keep that grazing clean. Basically what we ended up doing, is our lambs never see grass. They're always fed out in feedlots. The reality is if your lambs hit pasture with mom and dad, you probably are going to have, or with mom, you're going to probably have some pretty good challenges. The little bar graphs, basically that's just some research we did on differences in average daily gain in the feedlot lambs to pasture lambs. It's actually a pretty significant difference. So I've already talked about the 3 different groups: benzimidazoles, the levamisole group, and the avermectins or ivermectins. Resistance has been reported to all 3. So the reality is we're running out of drugs to treat parasites. I'm sure a lot of you have done FAMACHA testing. This is just basically the little card and the colors. Some of the worst memories I have raising sheep was FAMACHA testing 500 ewes and 90-degree temperatures out on pasture. But we had such a resistance problem to Homunculus that it was close to destroying our research project. We're going to finish up here really quickly. As a lot of you are probably getting ready to start lambing, I want to touch on this topic of zoonotic diseases. Zoonotic diseases are transmitted from animals to humans. Unfortunately, a lot of the diseases you're going to deal with in a lambing barn, especially most of the abortion diseases, E. coli, salmonella, are all potentially zoonotic diseases. The high risk groups, obviously, as livestock producers, we're out there all the time. Slaughterhouse workers, renders, veterinarians. This is the group that you need to be looking out for in your own operations. That pregnant woman. To be honest, I'm not sure pregnant women have any business around lambing sheep. The abortion diseases all transmit and can cause abortions in pregnant women. Individuals with pre-existing health conditions, I'm in this next group, and it makes me nervous. A year ago, I developed valvular heart disease. Prosthetic heart valves, mine's made out of Dacron. So I'm a teeny bit nervous. Immunosuppressed people, anybody on chemotherapy, immunodeficient diseases, a lot of the leukemias will leave you immunodeficient besides immunosuppressed. The very young and the very old. The reality is you're out in the lambing barns, neighbors and kids and friends and family are going to stop by. They're going to want to see the lambs. They're so cute. Be aware. Just be aware of the risks. I think the entire planet has figured out that, infectious disease is a whole different ballgame after a year of playing in a pandemic. So, just be cautious in your own environment and livestock production. I think we'll stop here and those of you that are still awake, maybe we can entertain some questions.
Okay, so Larry, can you hear me? Just check
Yeah.
and see if my mic's working. Okay, good. So for anybody still with us, if you have a question you would like Dr. Holler to answer, please type that in the chat. We're monitoring that. And so did have a couple questions. One of them that came up, and I know, again, Dr. Holler, this necessarily was not a nutrition talk, but you're also have spent a fair amount of your research or practicing time in reproductive world. And so the question was kind of targeted to trace mineral supplementation to sheep.
Okay.
So I don't know. I'll kind of maybe stop there, and what might be some of your thoughts, pros, cons, negatives on trace mineral supplementation?
Well, I mean, we've been in the years I've raised sheep. I started raising sheep out in with my wife out in eastern Washington, northern Idaho, in a range band of 1,200 ewes. Trace mineral, you know, seemed like they didn't really have a lot of challenges. We threw, seems like salt consisted of rock salt thrown on tree stumps out in the forest. As we moved back here, trace mineral in our own flock, became a little more important. You obviously, the issue you need to watch with trace mineral is making sure you buy the right trace mineral. Copper is probably the biggest challenge for sheep producers, because if they go to the local farm store and buy, just some generic bag, it's likely to have been designed for cattle, and it will have copper levels that will be toxic to sheep. We went through the period where we were making our own trace mineral salts. Realistically, we were probably saving a few dollars. Back in the day when Jerry Kennedy at Pipestone was live, him and I'd argue quite a bit about, he kind of had his views and I kind of had my views, and I never did convince him he was wrong. But the reality is that it's important, and right now we feed a good commercial trace mineral sheep salt product, and it's got adequate selenium. We're on the eastern part of South Dakota. We're not particularly selenium deficient, but you don't have to go very far west here that you'll have pockets of selenium deficiency and toxicity, and they can actually be in the same county. South Dakota is a really weird state that way. So we feed a lot of dollars in trace mineral every year. I believe it. It's just part of a good management. I don't like paying the bill, but it's part of a good management program.
Okay, very good. So another question that came in, and again, I realize this necessarily was not a nutrition talk, but I'll try to sum it up as best I can. So I would say somebody's probably had some ewes at one time. When you get close to lambing time, lambs seem to be in good shape, but nutrition maybe was a little bit of a factor. Started having ewe death loss, possibility of like a pregnancy toxemia. So maybe just talk a little bit about nutrition leading up to parturition, to lambing time, that maybe we can avoid some of those sorts of toxemia type incidences when lambing time approaches?
Well, there's multiple ways to screw up nutrition getting ready to lamb, and I've done them all. Too fat, too thin, too anything. I think over the years we've kind of learned a little bit that you want those ewes in a good body condition. You don't want them rolling fat with big knots of fat over their tail head, and you're imagining they have ribs. You want them, I tend to maybe, you don't want them bone thin. Obviously I can generically I'll say, well, you want them just right. Well, to be honest, that takes experience to find that out. We've learned over the years, we don't like them too fat. That's bad. They don't seem to milk as well. You're going to have increased dystocias. The lambs don't, everything doesn't go well. And you can have just as many problems with ketosis on fat ewes trying to all of a sudden metabolize all that fat for energy. Too thin, obviously, you can have the exact same challenges. Too thin, getting into ketosis, they don't have enough energy reserves. So, the reality is you want to be there in that spot. Now, if they're teeny bit thin, I find I can do more with those. I can up that corn to 1.5 pounds over not a real long period of time. I try to keep them on, as they're going into lambing on a little bit of an increasing plane of nutrition, obviously. Mid-gestation, or, mid-gestation, you can get by pretty easy. What we find, and what we found was always our biggest challenge, the more sheep we had, the less hands-on contact you had. It's really hard to body score a sheep driving by with a feed wagon. All our rations were TMRs, and a hired man, I think, would be doing good to notice if there was like somebody dead laying in the pen, let alone, whether she was a little bit too fat or too thin. So, that's part of being the shepherd. You need to get your hands on them. For me, shearing is that day when all of a sudden I find out whether I did good or whether I did bad. A lot of times in between that, until you get that wool off, you don't know. I like to get the wool off early enough that if I did undershoot, that I've got some time to put some condition, put a little condition back on. But it's phenomenally hard to gain a lot of weight on ewes once they hit that, those last part of gestation. Those lambs are growing so fast that they're sucking everything. Pretty much everything you put in the ewes is going to go to those lambs. So, yeah, we've had years where we really fought ketosis, and most of the really bad ones where the ewes were over fat. I think I've had more trouble with those. Throw parasites on top of that, and some of those years were just disasters. Trying to clean up the parasites, and once they get ketotic, a ketotic ewe is phenomenally difficult. Ketosis, oftentimes they have plenty of glucose, they just can't utilize it in the cell. Being a veterinarian and have a little bit more access to stuff than I should, I've actually played with using some insulin on ketotic ewes. Insulin obviously drives glucose into the cells. It's what needs to happen. And other than the fact you couldn't afford the insulin, it seems to work. But you'd have more money in the sheep than she's worth. But
right.
anyway,
So,
go ahead.
So leading up to parturition, if you will, lambing time. What's kind of the base forage part of your ration? Are you kind of a corn silage type person, alfalfa hay? What from a forage aspect of it, what do you like?
So we've done it all over the years. We used to corn silage in bags. The big challenge we had, even with bags, and I can honestly say we've pretty well made every mistake that you could ever make raising sheep. And so we had bags, couldn't figure out how to control the rodents. And so the rodents that eat holes in our bags, and then we get these little pockets of spoiled silage. And within spoiled silage, we had listeria. And so you'd end up with, or anything worse than having ewes show up in the lambing barn with listeria, or a week or so before lambing with listeria. Because no matter how good you are, you're going to probably save 1 out of 20 listeria ewes. And I'm talking aggressive. That's me being stubborn, aggressively treating them. So we don't feed a lot of corn silage. I think we could do better now because we actually went back and managed the rodents. So that means our bags would be better, with my health problems, we've cut our ewe flock down to 200 and whatever it is, 230 or whatever. So now we're back to pretty much a hay, corn screenings ration. We actually get corn screenings really cheap. We'll kind of do that a little bit. It's a mixture of pretty good quality grass hay, and then we've got a lot of alfalfa. And of course, we have the capacity in the feed wagon to blend it. And so as we go farther, closer to lambing, the need for protein increases, and we'll start, the ration will start adding a little more alfalfa. We think alfalfa was good enough. We probably can get by. Some years when that's not the case, some soybean meal or distillers will get added into the ration. Corn, we'd add ground corn into the TMR with our numbers down, and we actually have plenty feed bunk space. I'm kind of guessing we'll just kind of go back to the old days and probably bucket feed them a little bit extra corn as we get closer to lambing. We've got the capacity to feed pretty much the entire flock inside, for the winters we have. Even when we had 500, we had enough drive-by feed bunks, most of which had inside feed bunks. So, sometimes in South Dakota, tomorrow morning will be an example. I don't think anything's getting fed tomorrow morning. That it probably will be late tomorrow afternoon before we get the wagon out.
So I'm just interested. Your corn screenings. Are you doing anything to control the dust factor on that? Are you? So
we've done a lot of different things. Obviously, you want the screenings to stick to something. So a lot of times we'll add some water to the wagon, just enough water to stick the corn screenings to the hay. One year we had the bright idea, and we have neighbors across the road that run their own ethanol plant, and then they kind of got out of the ethanol and went to making lick tubs. Well, they developed their own process for purifying proteins from cereal grains. It's pretty, for a bunch of farmers, it's actually pretty clever. But as part of this process, so they'd separate out this protein. So they might have, they'd have, multiple thousand gallons of barley protein. Well, they also, as part of it, they would wash off the sugar, the glucose. And so they'd have pure glucose water. Well, we got the bright-eyed. They had to get rid of the glucose water. The DNR didn't want them dumping sugar water to anything. And so we started feeding sugar water to the sheep. Well, glucose, it should be good. Why not? Controls the dust added in. Remember earlier I was talking about the little challenge we had with Clostridium sordelii? Turns out Clostridium sordelii likes glucose really, really well. And so when we got up closer to lambing, we were feeding sugar water and everything fell apart. We had baby lambs, once they were old enough to start licking the sugar water, they'd crawl in the feed bunks and sit there and just lick the glucose off the hay. We had ewes that, especially close to lambing when we were feeding the glucose, they would die of twisted intestines. So it was really cheap and really good and cost us a small fortune. So we use water now. We used to use syrup, distiller syrup. When the neighbors were running the ethanol plant, we'd get syrup for free. Got to be a little careful with syrup and polio, because it has a lot of sulfur in it.
Sure. Still monitoring the chat if anybody has any questions, but one of the things that I kind of picked up on earlier in your presentation, you talked about a lot of the research you've done on antibiotic resistant pathways and the fact that your buyers at the packing plant are really clamping down on really any antibiotic use moving forward. So talk to me a little bit about your research as far as what you've been able to see as far as antibiotic resistance moving through that animal into the meat product, if you will, and what kind of science or what are they using as far as a basis for restricting antibiotics or limiting antibiotic use at the farm level moving forward, because that's something producers really are going to have to wrestle with, not only in the sheep world, but in a lot of the animal livestock world moving forward.
Well, I won't say it all makes perfect sense. There's a certain amount of paranoia that enters this discussion. That being said, livestock producers aren't going to win that battle. The human health side of antimicrobial resistance has a much larger bully pulpit from which to scream from. And so, one would argue, well, most of the antibiotics we use in veterinary medicine, animal production, don't pertain to human medicine. Well, they'll argue is that we don't know that. We don't know the secondary effects. If you're we use a lot of drugs in classes of antibiotics that, didn't exist 25 years ago. We're using fluoroquinolones, all kinds of drugs that are, they're probably not frontline drugs in human medicine, but they're in those cascades of drugs. So it's hard to know where it's all going to end. I'm just going to go out on a limb and say we're not going to win. So the reality is you're going to figure out ways to do more with less. We have in our flock, I didn't think it was possible. I mean, I used to live and die by the needle, but we have amazingly reduced our use of antibiotics. I don't feed tetracycline anymore. We used to, I would have thought I couldn't have even begun not to feed tetracycline. We haven't fed tetracycline for 10 years now. We're in a little bit different category because, if our research is ever successful, FDA is going to want to know everything we do with these animals. So we keep good records of who's treated, which is actually required by, we market all our lambs pretty much through Superior Pack. And so they want to know we're part of a natural lamb cooperative. So anybody that's been treated goes a whole different direction than the antibiotic-free lambs. So it's possible. I mean, I go over and I'm sure you're probably familiar with the Pipestone project, the Pipestone Veterinary Clinic and the Pipestone. You know, I kind of work with those guys quite a bit. I know all those guys, and we Dr. Larry Geltz and I have, we kind of do dog and pony shows on antimicrobial resistance, how to, Pipestone project, there's not a group of individuals and or veterinarians from the clinic that probably used more antibiotics than anybody on the planet. Jerry Kennedy was a firm believer in antibiotics. And so it's really been hard to have the packer tell them no. And so all that whole group of producers are trying to figure out how to do it. Some have been successful, some not so much. And it all comes down to kind of some of the things we mentioned earlier. It's the ability to instigate some of the management. Sometimes you can't do anything. You've got so many sheep, the density's so high, the weather's so crappy, the on and on and on and on. That stuff just doesn't always. I don't do much work for people that don't have problems. Is kind of how my game works. I get a lot of phone calls every day, and very seldom is it somebody saying, "Gee, doc, life's good. How about you?" It's, "Gee, doc, the damn wheels have fallen off. What the hell can I do to salvage this wreck?" That's the game I play. So.
Absolutely.
Yeah.
So do you, just economically, do you see that antibiotic-free market becoming more the standard, where they're really?
I think it is already the standard, especially in any areas where the producers are significant size. I mean, if you're still dropping lambs off at a sale barn, it's probably not a big deal. But if you're selling marketing direct to the packer, they already hammer us if they're not antibiotic free. And so, the whole Pipestone project, all those, however many thousands of lambs those are all marketed through a packer. So the reality is there's going to be fewer and fewer commercial markets. Now, that being said, there's, I think a lot of lambs today are being marketed through secondary channels, ethnic markets and direct sales. And, I have a Hutterite colony across the road that loves lamb for some reason. I mean, so, there's alternate markets, but our big market, when we sell hundreds and hundreds of lambs, it's a big thing, and they want affidavits with every loads of lambs that they are antibiotic free. I think there's other, not supposed to have any hormones or whatever else, but decox is good. They're still okay. But yeah, they make you sign the paper. Now, I'm a teeny bit skeptical that there might be a little fudging, because I know as well as probably most everybody else knows, they play that game. What is the odds of getting caught? And they're probably very low, but they're not zero. So,
sure.
Mm-hmm. If I didn't sell lambs to Superior, I'd probably, I guess, what do you have for markets down in Northwest Missouri? Where do you take lambs?
So, yeah, to answer that question, there's a lot of lambs get marketed as feeders around here through a livestock setting. So there are a few fat lamb buyers. Nothing particularly that you would take directly to a plant.
It's kind of created a little headache for the guys that feed up here, because I'm buying a whole load of feeders. I don't really know what happened to those feeders. But if I don't know, and I can't get an affidavit from the guy that sold them to me that they're antibiotic free, I can't represent them as antibiotic free. So, you know, fortunately, most of the feeders, you know, are pretty good size up here. And so they have a lot of, maybe a few more markets to go. But, you know, the challenge is there's not very many packers left.
Right.
You know, we've got a few that are trying to start, which I would argue the lifespan of a new packer in this country is definitely measured in years, not decades. You know, so if they make it 5 years, I'll be impressed.
Right. And so your term antibiotic free, when you use that term, it's like a never ever antibiotic.
It is never ever antibiotic. That's what Superior wants. And that's what makes it so challenging. You know, Jerry Kennedy and I used to argue, because Jerry's standard procedure was to give every lamb a cc of penicillin the minute it hit the ground. I mean, if he could intercept it on the way down to the ground with a syringe, he was happy. And, you know, it's like, sorry, Jerry, that doesn't count. That's not antibiotic free anymore.
Right. Right.
Jerry and I'd be on programs together talking, and he'd show up with a box of drugs. You know, he'd just gone through the clinic and pulled stuff off the shelf, and he'd give a talk about, you know, here's the drug, you use it to treat this, 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 and this. It was, I loved the man. He was great. He used to think I was a pinhead academic, you know, forever, until he had an abortion storm problem, and I was able to solve it for him. And I went from pinhead to savior in overnight. I mean, I don't think my stock has ever gone up that high. Yeah. So what else we got?
Well, Larry, I just monitoring the chat. It looks like kind of that's what we have for this evening.
Okay.
As far as questions. And so I guess, you know, we're about an hour and a half deep now. And so I will probably say that's probably going to wrap us up for this evening. And so just want to extend a big thank you to you for your presentation tonight. Very enlightening. I want to thank everybody that tuned in this evening. And remind everyone again to go to MissouriLivestock.com and check out all of our past recordings and our future programs coming up. And of course, you'll find this one on the website soon. So,
Zach, again, if you want, I mean, you can give I don't know if I get the phone number for the laboratory. You know, people want to call with questions, that's fine too. So.
Sure. So yeah, we can dig that out and post that, and maybe we can do this again, because I've read up on your project you've got going on with glycoscience, and that looks interesting, and
Okay.
maybe we can do that in the near future, because I'd sure like to hear more about that one. So.
Yeah, we sure can do that.
Absolutely. So again, thanks to Dr. Holler for joining us this evening. Thanks everyone for joining in. Again, MissouriLivestock.com. I want to thank all of our sponsors. And I think that will wrap us up for this evening. So Larry, stay safe, stay warm, and hope the wind doesn't blow you over too much overnight.
I don't believe we'll be going out too early in the morning. The sheep will be on their own.
I understand that. I understand.
All right. You guys take care.
Thank you very much.
All right. Bye-bye.
Bye.